With hundreds of COVID-19 cases on the Central Coast still considered active, some people are wondering at what point a person is considered recovered from the virus. KSBY News reporter Sydney Brandt found some answers.
Paso Robles resident Christopher Smith tested positive for COVID-19 last month.
I'm a normal mask person, but I wasn't wearing one then.
At 47 years old, the construction contract worker says he was neverly over concerned.
Went home about 7:30 at 100. By 9:30, I had a fever of 103.
Both Smith's daughter and wife ended up also testing positive for COVID-19. He says after learning of his positive test results, health officials told him he could return to work 10 days after he began showing symptoms. In Santa Barbara County, public health officials give the same advice.
So 6 feet for 15 minutes, 2 days before they had symptoms or 2 days before they got tested until they're not infectious anymore, and that's usually about 10 days after they develop symptoms or 10 days after they got tested.
The Santa Barbara County Public Health Emergency Manager says the county does not require people to get retested before returning to work. The CDC defines recovered as at least 24 hours without a fever, improvements in respiratory symptoms, and at least 10 passing days since symptoms first appeared. Health officials say those who have tested positive for COVID-19 should isolate, and the term quarantine should only be used for those who have had close contact with someone who has the virus but have not yet been determined infected themselves.
If they become positive during that period, they now become a case and they're subject to isolation.
Smith says he returned to work 10 days after symptoms first appeared, but it took him 1 month to feel 100% back to normal. Reporting in San Luis Obispo, Sydney Brandt, KSBY News.